Welcome back to Morning Break, and this week's Monday Motivations brought to you by Gates Brain Health. We are so excited now to have Dr. Randall Gates, a board-certified chiropractic neurologist and chiropractic physician. And I was telling you right before the commercial break, I was going to butcher it, and I totally did. We are so glad to have you here. I feel like it's been forever since we've hung out, so this is exciting.
Yeah, it's like a month and a half.
I know, right? I hope you had a good holiday.
Yeah,
yes.
you too. Yeah.
Very cool. Okay, so right now what we're talking about is balance. It's something that I, as a klutz, am very familiar with the lack of, but it is also something that can have much deeper neurological implications, right? So let's talk about where our balance comes from.
Think of the back of your head, the suboccipital area. Your cerebellum lies in that region, actually right there.
Right there at the bottom,
at the base of the brain.
Yes, and I think we have a picture of it too.
I think we do too, yeah. So your cerebellum coordinates everything from movements to thoughts to helping us have good balance. So any condition that affects the cerebellum or that maybe deprives the cerebellum of sensation, like those with neuropathy in their feet, diabetic neuropathy, other types of neuropathy, they don't get the right sensory feedback to their cerebellum.
So why does it seem to affect us as we get older?
Great question. So as we age, our neurons kind of decline. We have a tendency for that. Our brains are more dense when we're 20 than typically when we're 80 or 85. So we lose neurons, and as we lose neurons, we also lose sensation from our feet. We tend to develop eye conditions, cataracts, glaucoma, and macular degeneration, and our inner ear tends to decline in its function. So all those factors then lead to balance having a tendency to not be as good.
And you already mentioned a few of them, but there are also neurological disorders that can also lead to balance issues.
Yeah, there's a group called the ataxias. Some of them are genetic. Parkinson's disease can certainly affect balance. Strokes can affect balance. Other demyelinating processes in the brain can affect balance. So yeah, most neurological conditions can have some impact on balance, just depends on how much.
And you're seeing a lot of patients with balance issues at your office, right?
Yeah. And we have a unique approach at our office. The standard mainstream approach, and my best friend's a physical therapist, theirs is more trying to get people to work on their balance, giving them certain exercises, and that's wonderful. And I will also say if that's not working, my approach is a little different. It's more focused on the area that may not be working correctly, like if somebody had a stroke in their left cerebellum, I'm going to direct rehab to that cerebellum. Or if they can't feel their feet, we're going to do things to try and improve sensation from their feet. So we really try to make it specific to that individual.
Okay.
And how we're helping them.
Well, that makes a lot of sense, and I will say I think this is something that while it may affect more older people, injuries can also affect our cerebellum as well, even no matter what age you are, right?
Oh yeah. 'Tis the season right now. A lot of people are up on the hill, and we're actually going to film a commercial today about this.
Okay.
Because so many people are sustaining brain injuries, sadly. And brain injuries certainly can impact the cerebellum too.
And you mentioned that the cerebellum is the back of the head, right? So I think of a lot of the times when even myself have had a concussion, it's usually the back of the head that I've hit. Is that one kind of the effects?
Yeah. And in fact, some of the main objective indicators we're finding of concussion actually lie in the cerebellum.
Really?
Yeah,
okay.
so there's been a lot of research out of Canada on eye movements being disrupted after concussions. You can predict if somebody's going to develop post-concussion syndrome based on how their eyes move.
Okay.
And a lot of that is mediated from the cerebellum. Not entirely, but a lot.
Very interesting. So it goes to show you that it doesn't matter if you're 90 years old or you're 9 years old, your cerebellum is important to basically everyday life.
Oh my gosh, yeah. Come hang out with me for a week and you'll see when the cerebellum's not working well, the devastating effects of that.
Perfect. So, well, Dr. Gates, we always appreciate you being here. I will make sure that all of Dr. Gates' information is on our website, kolotv.com, so that if you have any questions, comments, or concerns, you can let him know and go and pay him a visit. So, Dr. Gates, thank you for being here.
Thanks for having me, as always.
We'll be right back after this quick break.